Welcome again, everyone. This is Medicine with Ali's with case-based principles. Let's start with our question. Which of the following medications is most appropriate for reducing the risk of thromboembolism in a 67-year-old man with a new onset, non-valvular atrial fibrillation hypertension type 2 DM and CKD stage 5, not on dialysis? Okay, now we have two questions. Question number one, does the patient need anticoagulation or not? Question number two, which anticoagulation you are going to use? Well, you can pause the video and try to answer the question. Okay, we'll move with the answer. The answer is warfarin. Why? مع انه we know this is non-valvular AFib. It's well known انه in non-valvular AFib, it's preferred to use DUAC, direct acting anticoagulant. Okay? اللي هم مثل rivaroxaban, dabigatran, apixaban, and edoxaban. Why do we use warfarin in this patient? Because this patient has CKD stage 5, which means the creatinine clearance or the GFR, which means that the GFR is below 15, right? So if the GFR is below 15 and the patient has non-valvular AFib, the recommendation is to use warfarin. It's much more preferred. We don't have clinical trials on those patients with GFR below 15 and used rivaroxaban or direct oral anticoagulant. So the first question is, does the patient need anticoagulation or not? طيب, we have two big categories in atrial fibrillation. Category number one is called valvular AFib. Category number two is called non-valvular AFib. Valvular AFib means two things. Number one, إما إنها تكون moderate to severe mitral stenosis, okay, moderate to severe mitral stenosis, or mechanical valve. These two بنسميهم valvular AFib. Any atrial fibrillation مش داخل هذول مش مع هذول two conditions بنسميه non-valvular AFib. All right. So the first question is, we have now in this patient we have non-valvular AFib, which means it's not moderate to severe mitral stenosis and it is not mechanical valve, right? Right. So if you have a non-valvular AFib, you use the CHADS-VASc score. So CHADS-VASc, we don't use it in the valvular AFib. You don't need it. You need it in the non-valvular AFib, all right? Right. CHADS-VASc score, it's a scoring system that uses these letters, to score the patient into low risk, moderate risk, or high risk for stroke, ischemic stroke, right? So C is congestive heart failure, H is hypertension, A2 is age. Why do we call it A2? عشان ياخد 2 points here. And it's above 75 because we have another A that's above 65. If it's above 65, we'll give it 1. But if it's 75 and more, we give it 2 points because the risk is higher, right? Then we have S2, means stroke or TIA, or thromboembolism, we give them 2 points. Then we have vascular atherosclerotic disease, مثل إيش؟ مثل prior myocardial infarction, peripheral arterial disease, and aortic plaque. Then we have the age, we mentioned that. Then we have the sixth category, female gender. Female gender, we give them 1 point. Being a female, that means only being a female, it means your CHADS-VASc score is 1, only for only being a female. All right. So any female on Earth, the CHADS-VASc score is going to be 1 at least. Okay. All right. Now, so the first question is, do we need to anticoagulate in this patient or not? The indication to anticoagulate or not depends on the CHADS-VASc score. If it's 2 or more in males, then the patient needs anticoagulation. If it's 3 or more in females, then the patient needs anticoagulation. All right. All right. Now, if the anticoagulation is required, but the GFR is below 15, then it means you are going to use warfarin. Now, how about if the anticoagulation is required and the eGFR is below 30? It's preferable to use warfarin in those patients as well, although there are some data for dose-adjusted NUAC and DUAC, but still the preferred option is going to be warfarin, even in non-valvular AFib. All right, لأنه valvular AFib we use warfarin, we know that. In valvular AFib means a moderate to severe mitral stenosis or mechanical valve, you are going to use warfarin. But in non-valvular AFib, you are going to use DUAC or NUAC, except in this situation when the GFR is below 15 or below 30. All right. Now, here's a side note here. In Australian guidelines 2018, they recommend removing the 6th category from the CHADS-VASc score to become CHADS-VA only, without the SC, without this one, SC, 6th category. So they remove the gender differentiation. So anticoagulation is strongly recommended if the CHADS-VA is 1 in the Australian guidelines. All right? Good. Now, one more thing. Now, regarding the perioperative management of anticoagulation, we call atrial fibrillation, we call it high risk if the CHADS-VASc is more than 7. We call it intermediate risk if it's 5 to 6. What does that mean? It means if you have a patient with atrial fibrillation and his CHADS-VASc is 5 to 6, then the perioperative risk is moderate for thromboembolism, right? Now, if you have a patient with atrial fibrillation and the CHADS-VASc score is 7 or more, then the perioperative risk is going to be high, more than 10% per year. Okay? Good. Now, this is just to tell you, the CHADS-VASc score is also used for perioperative risk stratification of atrial fibrillation in patients going to do operations.